Hello, today we are going to talk about tafamidis treatment for patients with transthyretin amyloid cardiomyopathy. The introduction is the following. Transthyretin amyloid cardiomyopathy is caused by the deposition of transthyretin amyloid fibrillin into the myocardium. The deposition occurs when wild-type or variant transthyretin becomes unstable and misfolds. Tafamidis binds to transthyretin, preventing tetramer dislocation and amyloidogenesis. Right now, we are going to observe a video that talks more about the illness.
Amyloidotic polyneuropathy was the name given to this because the principal feature of the disease clinically is neuropathy. However, we now know that this systemic form of amyloidosis not only gives peripheral neuropathy, but in most patients actually causes cardiomyopathy as well, where the amyloid protein is deposited in the heart, causes what is called a restrictive cardiomyopathy with low cardiac filling and low output. And patients very often die of congestive heart failure. So the better name for it now is transthyretin amyloidosis, or ATTR as we call it. Transthyretin was originally named prealbumin because the protein travels ahead of albumin in the electrophoresis. But that name has been displaced by probably a better name, transthyretin, which means it transports thyroid hormone and retinol binding protein, vitamin A. And those are the two functions of this blood protein. Some species don't have the same function, but these are the functions. It's probably not a serum protein that we need. We have mice that we have what is called knockout. They do not have transthyretin, and they seem to do quite well. They have babies, have more mice, and don't seem to have a shortened lifespan. So if we get rid of this protein in humans, it's hypothesized that we will not do any great harm. With familial amyloidotic polyneuropathy or transthyretin amyloidosis, the pathology is that the mutant transthyretin, which has a genetically inherited mutation, the gene, causes an abnormal protein which deposits in the tissues with the nerves, the heart, or other systemic organs, and causes the pathology by displacement of normal structures. The disease in humans is usually relatively insidious, then slowly progresses for 5, 10, 15 years. As I said, death is very often from cardiac failure. This is an adult onset disease. Usually patients are over 50 years of age, very often between 50 and 60 years of age before they develop significant neuropathy or cardiomyopathy. I have seen patients who have developed the condition in their teenage years and may be dead in their 20s. Most common variant of transthyretin amyloidosis occurs in northern Portugal and in Japan, where onset is in the 30s. Patients are often dead by age 40. In the United States, most of the transthyretin mutation patients present somewhat later and have a 10 to 15 year
Next, we have the applications of tafamidis in medicine. Tafamidis is being used in patients with TAC in order to achieve reductions in all-cause mortality and improve the quality of their lifestyle. Here we have another video that talks about ATTR.
These instances, we may be able even to improve the situation, not just slow it down. But we're very excited about this.
Here's another video explaining more about the illness.
This animation is specifically about ATTR amyloidosis. To understand more about amyloidosis or learn about other types, go to the Amyloidosis Research Consortium website at www.arci.org or www.arci.org.uk. ATTR amyloidosis is caused by the misfolding of a protein called transthyretin, or TTR, which aggregates and deposits as amyloid in various tissues and organs. TTR is mostly made in the liver. Once released into the bloodstream, its role is to transport vitamin A and the hormone thyroxine around the body. In order to do so, 4 individual TTR proteins must be attached to each other to form a 4-unit complex before it can carry vitamin A or thyroxine. In ATTR amyloidosis, the 4-unit complex is made up in the normal way, but is unstable and prone to breaking up. In some cases, this is a result of inheriting a mutation in the TTR gene, which gives rise to TTR proteins that don't fit well together. This is known as hereditary ATTR amyloidosis. In other cases, the individual TTR proteins become altered as we age. But what causes this to happen isn't known. This type is generally referred to as wild-type ATTR amyloidosis. Once apart, the TTR proteins have a tendency to misfold and aggregate to form fibrils, which deposit as amyloid. TTR amyloid deposits are most commonly found in the heart, where they cause cardiomyopathy, and in the nervous system, where they cause neuropathy. Deposits can also be found in the digestive system and kidneys. As the amyloid builds up, it starts to disrupt the function of affected organs and cause symptoms. Treatment is aimed at reducing TTR production or at stabilizing the 4-unit complex. Until recently, a liver transplant was the only way to stop TTR being made, but novel treatments, including gene silencing technology, are being used as another way of stopping the body from producing TTR. Drugs which stabilize the 4-unit complex are also being used as a way of reducing the chances of TTR misfolding and forming amyloid. The hope is that gene silencing and stabilizing treatments can reduce amyloid formation, help existing deposits break down naturally, and in doing so, restore organ function and improve quality of life for patients.
Now, the pros and cons of tafamidis treatment. The pros are that it increases the life expectancy of the symptoms of the diseases and therefore decreases the mortality rates production by this illness. It also reduces the cardiovascular related hospitalizations in patients that suffer from transthyretin amyloid cardiomyopathy. The cons are that the treatment takes too long to see the benefits, and it takes approximately 30 months. Also, there were some adverse effects that emerged during treatment, like diarrhea and urinary tract infections, but they were mild to moderate. The applications in our country. This treatment can help reduce the mortality rates in the patients that suffer from TAC. Here in Ecuador, increases their life expectancy and improving their chances of controlling the symptoms involved in the disease. Here is another video.
Transthyretin amyloid cardiomyopathy is an underdiagnosed, life-threatening disease that occurs when transthyretin protein accumulates and forms amyloid fibrils inside the heart, and typically die of progressive heart failure. Until now, there's been no medical treatment for transthyretin amyloid cardiomyopathy. In our study, a phase 3 clinical trial, we tested a new oral medicine called tafamidis. The drug binds to the transthyretin protein and prevents it from forming amyloid. we assessed the efficacy, safety, and tolerability of tafamidis in an international, placebo-controlled randomized study. We used a novel statistical approach to study rare diseases, the Finkelstein-Schoenfeld method, increasing the sensitivity and power of the analysis of a small cohort while prioritizing the importance of mortality and also addressing morbidity in the primary endpoint. In the trial, tafamidis lowered mortality by 33%, and cardiovascular-related. Additionally, tafamidis significantly reduces the decline in functional capacity and quality of life and was very well tolerated. Transthyretin amyloid cardiomyopathy has been considered rare because the diagnosis used to require a heart biopsy. But now, a simpler nuclear imaging technique allows doctors more easily to diagnose the disease. And with the advent of an effective therapy, tafamidis, the potential to dramatically improve the outcomes for affected patients is enormous.
So the conclusion is the following. In patients with heart failure due to TAC, treatment with tafamidis, it reduces all-cause mortality and cardiovascular-related hospitalizations as compared with placebo